Okay, good morning, everybody. I'm going to try this again. I did it. I can see it. It's on my the videos there. Nobody can get to it for some reason. I'm not sure why. So I know how to do this one. So this is live on me on my page. So all right. So what we're going to talk about is what I'm basically saying is calling the pandemic within the pandemic. And so I got thinking about this because we keep seeing jokes and memes and this, that, and the other thing, which are actually funny. So people are so clever, even during a ridiculous crisis. Um, so lots of memes of people, oh, I haven't changed, I don't have pants on. The David Letterman thing. I'm not wearing pants. If you remember that, I'm old enough to. And then people talking about, cutting their own hair, and ooh, I actually took a shower. And I actually took a shower this morning just to make a point. I have a nice shirt on, I think. Hopefully it doesn't blow your eyeballs out. It's kind of busy. And my hair is nice and curly. I haven't gelled it up, but this is what I look like after a shower, and I'm all cleaned up and dressed and all that. So what's happening is we are under a forced, in some instances, not always, but a lot of us are under a forced social distancing, which is what they're calling it. I'm going to talk about a guy that says it's unfortunate that it became known as social distancing because social distancing has some connotations and some problems, especially for your health and your mental health. He would like it to be known as physical distancing because that's really what we're talking about, right? So physical distancing is the way that the health people are saying that's the way we flatten the curve, this and that and the other thing. Social distancing, however, though, doesn't mean that you have to completely disassociate yourself from sociality. Okay, so social distancing, if you isolate, that's called social isolation or social isolation. And social isolation, of course, can lead to loneliness. Well, there's some health effects for that. So this is more of a touchy-feely live broadcast as opposed to my sciencey and medicine-y type stuff we talk about Monday and Wednesday. So this is more of a social science research, and I'm not a sociologist nor am I a psychologist. However, it is interesting what happens to people when they socially isolate and become lonely. Okay, so the definition really of social isolation in one paper that came up in December. So this guy called social isolation a person who lacks the opportunity for social interaction, okay, or social connection. So you don't have to be out and about and in restaurants and all that to have social connection. That's kind of what Facebook's about. And I clearly don't have a PhD in Facebook management. I think I have a high school diploma based on what I did this morning. So anyway, and then loneliness is really the distress that people experience due to the lack of social relationship. Well, that has some health bearing. So there was an article that came out, or a paper, December 2nd, 2019. And the name of it was The Next American Health Crisis is Social Isolation and Loneliness. Well, that guy was wrong because the next health American crisis, or the American health crisis, became this virus thing. Okay, but he's kind of on the right track because what we're doing right now during this virus is increasing the potential for social isolation and loneliness. Okay, so when you're isolated or if you're socially disconnected, and addicts, people that are addicted or alcoholics or whatever, know this because they isolate, and it increases negative behavior. So really, what is potentially a problem is people that smoke more because they're not doing anything technically, and alcohol sales are doing well, so people drink more, and then your physical activity goes down. And I'm going to prove it to you because I have the health app on my iPhone. Okay, so I'm not going to say I'm the most healthy person in the world because I'm not. However, I try. I never make it. I think the best I've come is 8,700 steps. So the recommendation is 10,000 steps a day, right? You've heard that for years. Okay, so before this shut down the social distancing thing, I was you could always tell when I was teaching at the high school because I walk the halls a lot. You could always tell when I was out walking the dog or going to the store or going to the State Fair Community College campus and teaching on campus, because I would average typically 5,000 to 7,000 steps a day. So we'll say average 6,000. Okay, so I pulled up my app this morning, and it counts your steps if your phone's on you. It's kind of handy. And so on April 8th, and I forgot to look up what day that was. Typically when I have little steps or not many steps, it's Sunday. On April 8th, I had 465 steps. Okay, so that's significantly lower than 6,000 or 7,000, right? So I'm not as physically active. I'm averaging now about 2,000 steps a day. Okay, so I'm not anywhere near where I was. Okay, so that's the lack of physical activity. And I'm not running marathons, and I'm not bench pressing 250 pounds, and I'm not doing all kinds of physical gym workout because gyms are closed for the most part. So my physical activity level, even though it's not high like when I was younger, has decreased significantly. Okay, so when I looked at all these studies, I got thinking that after seeing all these memes about people not doing anything and they're bored and they don't have anything to do and they're not going to work and all that, what does that mean? So if you look up the psychological research, it seems like everything I ran across, not everything, but a lot of what I ran across was from Brigham Young University. Okay, so in 2015, Brigham Young did a study and showed an increased mortality of 26 to 32%. So higher death rate just from people that are identified as socially isolated. Those people had higher blood pressure readings. Those people had a higher heart disease rate. And they defined the risk factors for social isolation as 1, living alone. So the paper in December said that, and it seems like a lot of this is geared toward older people, which they defined as 50 or older. I don't think that means you're old, because I'm almost 60, which is probably why I couldn't figure out this Facebook thing live this morning. But so they tend to look at studies in people that are over 50, and that's kind of risen not to the forefront, but it's become an interest of speculation as to how that impacts people that are older, probably because my generation, the baby boomers, are in that age group. So depending on how you define the birth year of baby boomers, there's people from late 50s to into their 70s that are considered part of that age group. So most of these sociological and psychological studies are in that age group. The other risk factors, I lost my train of thought. So the paper in December noted that in people over 50, 20% of those people live alone. Okay, so living alone is the risk factor for social isolation. And then social isolation doesn't have to, but it can lead to loneliness, which has another effect on health. People that have mobility and sensory impairment, so people that are severely disabled, are at risk for social isolation. Okay, people going through major life transitions. Most of us have done that. And I know if you've done it, if you've gone through a divorce, or you've lost your parents, or you have a child die, or a spouse die, or a good friend die, you want to withdraw from the world. Okay, so you're socially kind of isolating yourself. And then eventually, if you start feeling lonely, if you're a social person, you're going to reconnect and come out of that gloom and doom idea in your head. There is some correlation with social isolation based on geographic location. I didn't delve into that. I'm not sure what they're talking about. If they're talking about, small towns or rural living, people live in rural areas, I'm not sure what that means. And then there's a correlation with lower socioeconomic status. So that kind of makes sense. Okay, so who knew this? But the AARP does studies. I had no clue. And I've been a member since I was 50, even though I'm not retired. So you're eligible for AARP membership once you're 50, okay? Well, they looked at health expenditures related to social isolation, and they used Medicare data. And from their study, and I can't remember what the N number, the number of people they looked at, but the average expenditure for healthcare expenses directly related to social isolation was $1,608 per adult. Okay, and of course they were looking at people over 50 in their demographic. When you look at it nationwide, the healthcare expenditure by Medicare from social isolation, people that are identified as socially isolated, is $6.7 billion a year. Okay, so I'm going to hit you, I'm hitting you with statistics, and I love Mark Twain's quote on that. So there's lies, damn lies, and statistics, so I can probably prove anything to you with statistics. Which is probably why I dropped statistics in college. I hated it. I didn't get it. But statistics can be manipulated. Everybody knows that. Okay, there's another study that looked at millennials. Okay, and they defined millennials, I think this was 2 years ago, they defined millennials as age 23 to 38. And the millennials self-identified as 22% of them had no friends. Well, that's interesting because when I tell you these health benefits, we have the potential that the millennials, and I think really 38 probably fits Generation X more than millennials, maybe. So almost seems like they're talking about Generation X and misnamed it. But there's some potential chronic long health benefits from people if 1 in 5 people of that age group feel that they have no friends. So then that brings up the internet. So is the internet a social connectivity device, or is it bad? Is it not bad, but is it keeping you from socially interacting? Well, it's social media, so technically you're interacting, but it may be that loneliness is increased by internet usage. I mean, they're looking at internet and smartphone usage in teenagers and finding that PET scans of brains on teenagers that are using their smartphone have the same blood flow as cocaine users. So that has a negative connotation about internet use. However, it's almost a bidirectional two-edged sword. So you may increase your loneliness by staying away from offline relationships. So if you're spending all your time on the internet, you're not really interacting with your friends or other people, maybe even your house. But at the same time, it may decrease loneliness because you're forming or you're enhancing the existing relationships for people that you already interact with anyway. So it's a way to stay in touch. And then like I said, two-edged sword. I remember a divorce attorney friend of mine telling me, yeah, Facebook is 50% of the reason for divorce in the U.S., where people reconnect from their past, and one thing leads to another. So the internet, it's here to stay. It's just what's it going to do to us sociologically and psychologically. Okay, United Kingdom 2010 looked at quality of health, quality of life research, basically, in people that are over 50. Okay, so it was looking at social isolation with absence of contact with other people. And what they found was that social isolation was significantly and independently related to health status and health quality or health-related quality of life, Okay, so, and that was even though they accounted for depression, physical activity, comorbidity, so people that already had chronic illnesses they were dealing with, living alone, and employment status. So independent, just social isolation and lack of contact was associated with a decrease in health status. Okay, the guy that I said that I read about that wanted things called instead of social distancing, he thought physical distancing was a better idea, or a better way to say that, is a psychiatrist and epidemiologist at Duke University. And so he pointed out that loneliness does not have to come from social isolation. So if you think about this, a lot of you are working at home. You don't always have the ability to get distractions out of your way, but if you can, and you're working, you're socially isolated, right? So if the dog's barking, fine. If your kids are running around, fine. You're not totally socially isolated, but writers do this all the time. I'm trying to think which Stephen King writes about this in a book called On Writing, where he basically closes himself in and socially isolates for about 7 or 8 hours a day to write, and that's his job. So that's what he does. He's not lonely. You read about the guy; he has a bunch of fun, and he's not lonely, but he's socially isolated. Artists do this. There's people writing poetry. There's people that are singing songs. They're playing the piano. They're playing their guitar. They're doing whatever. And if they can socially isolate, they actually focus on that activity. Hi, Linda. And so, well, two Lindas, and you both spell your names L-Y. That's interesting. Never thought about that. Anyway, so, there are people that burn the midnight oil when everybody else is asleep, the TV's off, they're not interacting with anybody, they're interacting with what their focus is on. Okay, so for instance, one of the musicians that I follow here in Missouri, Molly Healy, about a month ago wrote a song in 30 minutes at 2:15 in the morning. Got it done by 2:45, and at 3 o'clock she played it and posted it. And then she used her home studio a week later with her daughter and actually polished it up. So 30 minutes, she had a nice new song just from isolating in the middle of the night. So you don't have to be lonely. So there's plenty of people that are socially isolated that don't become lonely. Okay, so loneliness, and this guy's this guy at Duke published he was part of a 281-page report looking at the health effects of social isolation associated with loneliness. Okay, so I got the gist of it, and I did not look at it because it would cost me $84 to download the book, and I wasn't willing to do that. Somebody's done that and put together a nice conglomeration of that, and what Dan Blazer found was that loneliness is associated with an increased risk of heart disease, stroke, dementia, Alzheimer's disease, high cholesterol, and those of you that read what I write, that's a whole nother Facebook Live I can do on what is considered high cholesterol. And then diabetes and generalized poor health. So that is the health effects, detrimental effects of being socially isolated to the point where you are lonely. Okay, then go back 41 years, 1979, Journal of Epidemiology, and they looked at 6,928 adults over 9 years. So they looked at it for 9 years to see what happens to mortality compared to just the general population. And this is, I think, in the United Kingdom. So lack of social and community ties, this is interesting. So 41 years ago, lack of social ties and interaction and community raised mortality rate in men by a factor of 2.3, and it raised mortality in women by a factor of 2.8. Okay, so that's 1979. So the majority of the research on social isolation and loneliness has come in the last 10 years as people realize these are detrimental health effects. Okay, 2010, a meta-analysis. And a meta-analysis is looking at independent studies, different independent studies, and looking for a trend. And what they found in this data was that it indicated lack of social relationships has the same health risk effect as smoking 15 cigarettes a day. So that's from a meta-analysis of several hundred papers, independent from each other. So being isolated, and they didn't even say lonely, they just said social isolation, you might as well be smoking 3/4 of a packet a day. Same health risk. Okay, there was a guy that put an article out in The Guardian March 18th where he interviewed and quoted, I'll get her name right, Julianne Holt-Lindstad. I hope I said that right. She's a psychologist and neuroscientist at Brigham Young University again. What she found was that social connectivity decreases inflammation, acute inflammation. And of course, you've heard me talk and write about The basis of most chronic disease is chronic inflammation. Okay, so chronic inflammation raises blood pressure, raises heart rate. She showed that there was an increased level of stress hormones, and then she didn't say this, but I'm extrapolating that she's talking about cortisol. And people that are wigged out and anxietous and stuff, and they can't go to sleep, they have a high late night cortisol level. It's easy to measure. Okay. And then the other thing she found was an increase in cellular aging. Okay. So, and then she looked at premature death rates. So she kind of quotes this in her little interview. So people that are socially isolated have a higher risk of premature death. Premature death. Okay, so for loneliness, the risk increases 26%. For social isolation, it increases 29%. And then the interesting one is if you live alone, your premature death rate is elevated by 32%. So a third higher. So that's kind of interesting. Okay, so do we have a coronavirus anxiety? Well, of course we do. So the coronavirus anxiety is kind of, if you go back into how your brain works, this is kind of how there's a basis for what people are doing. Okay, so there's an article in National Geographic that kind of looks at this or explains this, and I teach this in physiology, so it fits right with what I teach, and it's been about a month where we did the brain, physiology of the brain. Okay, so panic buying, now why it's toilet paper, I don't know, that doesn't make sense to me. But panic buying dates back, at least here in this country, to the Spanish flu epidemic of 1918. They were doing it back then, probably not toilet paper. And I didn't look up to see what they were panic buying and hoarding. But hoarding and panic buying is based in people feeling that their risk of survival is decreased. Okay, so if you're worried about your survival risk, there is some things that is one thing that you can do to take back control of your life, and that's the psychology behind panic buying. So when people feel like their survival is threatened, they will panic buy. Now, whatever that means with toilet paper, I don't know, because I can't imagine what that would do or what it means. That's starting to come back. I was at the store yesterday. There was toilet paper, not much paper towels, but it is there. It's not like it used to be, but it is there. For a couple of weeks, there was none. Any place I went, there was none. Okay, so what's the evolution of fear? Fear resides in your amygdala. That's in your midbrain, and it will take over your prefrontal cortex where you have rational thought. So if you are in danger or you have an imminent threat to your life, your amygdalary emotional response will take over your rational thought process. That's not always bad. So they talk about being surrounded by lions. And I think they also talked about if you were getting ready to be hit by a car. So let's say you're crossing the street, there's a car coming that may hit you. Your amygdala will take over, and you'll have an emotional reactive response that will probably save your life, as opposed to doing, okay, well, what speed is the car with your cortex? What speed is the car going? What's the angle of the tires? Is the person driving mad, or are they just driving? And what's the velocity angle and all that? If you sat and thought through all that, you're probably going to get squished. But your amygdala will overtake your cortex, and you will do the appropriate thing to save your life, right? Okay, so they describe panic as not an antisocial behavior, but a non-social behavior. So you're not really thinking about everybody else around you when you're panicking in that moment, which is more than likely okay if you're in imminent danger. Okay. However, anxiety affects decisions, and human beings are terribly not good at assessing their risk, especially risk of whatever, especially in times of uncertainty. Okay. So what's creating uncertainty? Well, first, we've been told that this is a virus nobody's seen. I talked to you about the doctors saying this doesn't look like anything that we've ever seen clinically, which is a little bit spooky if you wind up going to the hospital. And I'm not going to get into the politics of the media and the government and all that, but there have been inconsistent messages sent through the media, through the public health system, public health officials, and the government with varied recommendations, different states, different communities, etc., as to what social distancing or physical distancing should mean. And all of that is fueling anxiety. Okay? Well, if you're enough, so this is an acute anxiety, but the longer it goes, the more likely it is to potentially be chronic. If you're under chronic anxiety and stress, it will shrink your brain. So you get brain atrophy, just like a dementia person or an Alzheimer's person. So chronic anxiety has its own issue with your health. The other thing is some biases. So the one that was interesting was availability bias. And here's a personal story. When 9/11 happened, I could easily imagine me in a plane, or you would imagine, or I would, me in a plane flying into a building, and what would that be like? Or flying into the ground or whatever. So for me, and I wouldn't fly for 2 years, and I used to fly a lot, and then I flew again. But for 2 years, I would not get on a plane because I had so much anxiety about reliving that, people jumping off the World Trade Center and all that, and being in the people that were flying in the World Trade Center and all that. So I wouldn't do it. But I increased my risk of flying because of that anxiety about hearing that in the media over and over and over again. Okay, so my my former partner, Dr. Williams, he talked about some stuff live on April 15th, and one of the things that he said is, I'm sick and tired of hearing about COVID-19 and coronavirus. Well, there's a demonstration of anxiety, and he's a practicing physician, so he's in Oklahoma City dealing with all this. And he's sick of hearing about it, but it's part of his job, right? I mean, he's a physician. The other thing you can get, okay, so for 2 years I wouldn't fly just because of that media exposure of the World Trade Center and 9/11. So when I counsel people before surgery, their risk, people that have surgery would not all, but frequently would ask, what's my risk of dying? Going to sleep and not waking up, that's the big fear. And so I would explain it this way. So, and I would use flying is the most safe form of transportation we have. So your risk of dying in a plane crash is 1 in 25 million. So I would start that way, and I would say you do something every day if you're over 16 that's way more dangerous and likely to kill you, and that's drive your car. So statistically, remember Mark Twain, statistically, you have a 1 in 6,200 chance of dying every time you drive your car. Okay, so if you drive your car, you're, inches and feet away from cars going 70, 75, 80 miles an hour. And so if there's a mistake made, your chance of dying is fairly high in a high-speed crash, right? And then I would say, okay, so the risk of dying from anesthesia, and I might be wrong, so any CRNAs or anesthesiologists could argue with me, but I would say 1 in 450,000. So I tell a patient you have a 1 in 450,000 chance of dying from anesthesia and surgery, okay? The most common, well, not the most common, and then I would put it into this perspective. The chance of accidental death is 1 in 200, and the most dangerous thing that you do statistically in the morning is get out of bed. Okay, so think about, especially if you're older, so think about an old woman with osteoporosis. She gets out of bed, loses her balance, falls down, she lives alone, nobody's checking on her, and she falls down, breaks her hip, she's immobilized. Again, nobody's checking on her, she doesn't live with anybody, and she forms a deep venous thrombosis, throws a pulmonary embolism, and dies. From that, that's technically an accidental death from getting out of bed. So 1 in 200. So that would calm people's fears about having surgery. Okay, the other biases are pessimism and optimism. Okay, so I live in Boonville. It's 8,500 people. small businesses are closed. The restaurants are not, they're curbsiding, but, the gift stores and, Boonville's a big tourist town, so everything's shut. The casino's shut, all that. Boonvillians are still shopping. About a third of them are wearing masks. We've had one death from COVID-19 in Cooper County. There's been 4 in Howard County, which is right across the river. I think we've had 4 COVID-19 cases. Boonville's 8,500 people. So people aren't shopping, just shopping. People are still out walking their dogs and they're, bike riding. And so it really, and they're working at home. So there's not, we've closed the schools. The teachers are working from home, closed the campus. I'm working from home. So it hadn't really changed a whole lot. But this is an optimistic area because we've had 4 cases, right? Okay, the pessimistic view or pessimism bias is whatever you do, you're going to get it. It's so prevalent. So there was a nurse that posted a picture of New York City downtown, and she had put a whole bunch of COVID-19 viruses in the air all over the place. And she said, if you could see these floating around, would you go out in it? That's a pessimism bias. Okay, so you can almost talk yourself into anything, right? With those biases. Corey, my friend in St. Louis, was talking about confirmation bias yesterday or the day before, I can't remember, where you just gather data around that fits your hypothesis so you can prove that what you're saying is right. That's a confirmation bias. Okay, Lancet, March 2020, they did a review 3,000 independent papers studying the psychological effects of quarantine. So if you get a positive test and you're quarantined for 2 weeks, that doesn't mean like you're in the hole in prison, like when they punish people in quarantine and socially isolate them from everybody else. But prisons do that all the time. They socially isolate people who get in trouble or that cause trouble in prison. So the psychological effects that they found from quarantine, especially prolonged quarantine, is an elevated level of PTSD, post-traumatic stress disorder. And I know that term gets thrown around a lot, but if you have had PTSD or have talked to people that actually have had PTSD from sexual abuse or rape or Afghanistan war veterans, Vietnam War veterans, etc., it's a real thing. I took care of an addiction medicine patient in Oklahoma City from Afghanistan, and I closed the door. He was sitting on the office table, and I closed the door. I didn't slam it, but I kind of just pulled it, and it kind of shut with a noise, and he jumped off the table. So it just triggered his PTSD from being in Afghanistan. So it's a true thing. So you can get PTSD from a whole bunch of different things. The other one, infusion. The other one is anger that they identified in the Lancet. We're seeing people getting angry, okay? And then it raises fears. And of course, fears we just talked about. That's amygdala. That's from your midbrain. It's the emotional response. So the fears with this are financial loss, which is happening. Okay. Frustration, that's happening. See that all over the place. Boredom, that's happening. Fear of infection. So you're fearful that no matter what you do, you're going to get infected. And then the other fear is infecting other people. Okay. And then inadequate supplies. Okay. So there's the hoarding and again, why toilet paper? I don't know, but toilet paper. And other things. I noticed yesterday I went to this grocery store. There is not a can of chili beans in Boonville. So I think people are buying chili beans, dumping them in a pan, and eating them because I couldn't find one can of chili beans. The other thing that I was thinking about was, this flew out of my head. So now you actually see my ADD in process. I always tell people, your doctor doesn't have ADD, find one that does. So yeah, it just flew out of my head. It came in, it was a good point, and it flew out. Okay, so what can you do? So this is from New Zealand Mental Health. Okay, stay away from the news. That's hard to do if you're a news junkie, but part of this continuous coverage of this is increasing your anxiety. So take a news break. The other one, seek contact with others. It doesn't mean you have to go to their house or whatever, but you can reach out in whatever way you want. But interact with other people. Grounding, we'll talk about that in a minute. And then more time in nature. So we're seeing a lot of people. This is a bike riding community. The Katy Trail goes through here. Lots of bicycle riders. They're still out. They're out riding bikes. Okay, then, and I'll put this up later. There's a psychotherapist named Dr. Russ Harris that put together strategies for getting through the coronavirus panic. And he calls it Face COVID. So, of course, it's a mnemonic, like most healthcare people like mnemonics. Okay, so FACE. F stands for focus on what's in your control. So what you do not have control of is this virus. You can't make it do what you want it to. You do not have control of the future. You cannot predict the future. And that's basically talking about mindfulness, living in the present. Okay? What you can control is what you do. Now you can do idiotic things if you want, and you can do maybe risky things. So some of the distancing thing is forced upon us. So they're fining people, not necessarily arresting them and dragging them to jail, but issuing citations. There's one community I read about, $1,000 fine if you're caught outside by the police without a mask on. So some of it's forced, some of it's recommended, it's a recommendation. But you can control what you do. So while you're home, you can lay around and not do anything if you want, but you have that control. And then the ACE, he calls ACE, the next three, he calls that dropping an anchor. Okay, so basically you're grounding yourself. So the A is acknowledging your thoughts and your feelings and observing your inner world. So fear is not bad, anger is not bad, it just is. It doesn't mean there's something wrong with you. You just have to acknowledge, okay, what I'm feeling X, whatever that is, and just acknowledge that. It's part of your inner body. C is coming back into your body, okay? And that's basically talking about grounding to an extent. So, and I have sort of taught grounding several years ago. Could do a whole nother Facebook Live on grounding techniques. But basically, it's feeling what your body is interacting with. So your feet are on the floor. You can push down with your feet and feel the muscles in your calves and your feet. You can know that your knees are bent. You're sitting on a chair. The chair is soft or it's hard. You can feel the arms of the chair, whatever you feel with your hands. You can sit up straight. You can feel what straightening your spine feels like. That's all basically grounding techniques. Okay, then E, F-A-C-E. Engagement in what you are doing. Again, grounding. Look around. Notice what's on your walls. You spend a lot of time in your house, and I bet you don't know what's on your walls. I bet you don't know what's in your car. You're not really looking. So just pay attention to colors. Pay attention to what's around you. You can sit on your porch like I do. You look at your windows and notice things that you don't typically notice. That's another grounding technique. You can notice what things smell like. You can notice what you're hearing. So I sit on, if the sun's not up and I'm up sitting on the porch, I know the sun's getting ready to rise because I'm in a small town and I can hear the birds. Okay, so I've noticed that that's very noticeable. It's even more noticeable now that there's not all this movement going around. C, so the face COVID. The next C is committed actions. Okay, so committed actions. Protective measures, washing your hands, physical distance, blah, 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 all that, wearing a mask if that talks to you. But you can also reach out to other people. Phone calls, text, you can do Zoom meetings. You can do a whole bunch of stuff to stay socially interactive and reach out and make an action. Make sure you stay connected. You can play with your kids. You got time to play with your kids. You can actually cook a meal as opposed to dumping chili beans in a pot and eating them. Just take a recipe out and cook. If you don't know how to do that, learn. right? So that's a committed action. Okay, physical exercise. Okay, there are, and I have people that I interact with all the time that can help people do this. And if you want to know, I'll send you their names by messenger, or if with their permission, I'll put names up. I work with a couple of trainers that are teaching people how to stay physically fit at home without having to go to gyms since they're not open. Mindfulness is living in the present, just living in the present. I have a neurologist friend of mine in Oklahoma City. If 5 minutes goes by and he doesn't talk about mindfulness and mindfulness techniques, I wonder what's wrong with him. He is heavy into mindfulness as a neurologist. Okay, the O is opening up, meaning be kind to yourself. So kind of like when you fly and they tell you, the flight attendant says, if we depressurize in the cabin and the mask falls down, put your own mask on first and then help others around you or your children. So be kind to yourself first. V is values. Keep your values. You cannot accomplish everything that you did before this lockdown because you're not going to work and we're not doing all the things that we want to do. But you can do things at home or around you that keep your values intact. So an example would be supporting small and local businesses. Very simple. If you believe in that, do it. Restaurants are doing it. I mean, we're in a little town. We've got 3 or 4 family restaurants that are doing curbside service. People are there's one restaurant here that got a $1,000 check to help people pay for meals that couldn't afford it. Every week they're getting enough money that this particular restaurant is doing free meals for seniors or people that can't get out or people that just can't afford it. And so that's keeping her business afloat. Kind words and deeds to yourself. Talk to yourself as like you like yourself, right? And then you can do that for those in your immediate family. So that's all values. Okay, the I is identify resources. Okay, so you need to know emergency numbers. You need to know how to call the hospital ER. You need to know how to do a telemedicine visit with your doctor. They're all doing them. Some doctors' offices are still open. I do not think in any way I want to go sit in a family practice or an internal medicine doctor office in a group of people in a waiting room. But most of them are doing telemedicine now. Know the hotlines. If you need psychological help or counseling, I know people that will counsel you on the phone or by Zoom or however you want to do it. I know several of those. Suicide prevention hotlines. If you're feeling that way, reach out. You can always talk to somebody on a suicide prevention line. Addicts, there are addiction counselors. I've done it for 5 years. If somebody feels like they're going to relapse, you can talk them down. Might take you an hour, but you can almost always talk them down. They just need that community. When I gave my opiate talk in Cincinnati, I ran across that rat study that the general conclusion is the opposite of addiction is not sobriety. The opposite of addiction is community. So that's the reach out part for staying sober. And then there's Facebook groups for whatever you're struggling with or whatever your issue is. And some of them are amazing. This is off topic, but the one that I've seen grow the most is one on intermittent fasting and low carb diet for people managing their weight. That has grown. I joined that about a year ago. That's grown from 30,000 members to over 115,000 members. And they are the most supportive group of people while people go through their weight loss journey I've ever seen. It's amazing. They just lift each other up. They put before and after pictures on. There's all kinds of Facebook groups like that. And then the D, so face COVID. D is disinfect and distance. Okay, physical distance, not emotional distance. Okay, and so he ends this thing with a great quote from Churchill, which is, you've heard it, when you're going through hell, keep going, right? Locally, what we're doing, so this is a town of 8,500, central Missouri. Here's what Boonville's doing. A week or two ago, the Booster Club from Boonville High School Pirates put up banners of the senior athletes downtown, so you can drive away and see the kids that you're used to teaching, or people that kids that you know in the community. Parents of the graduating class of 2020 are decorating their doors. For the graduates, they're not going to have a graduation ceremony right now. They're not going to have prom right now. It's just Boonville's way of kind of staying connected to the community. 2 weeks ago, they had the Great Boonville Bear Hunt for kids and families, where people would put bears up in their windows, and they had a little map, so you had to find the bears and all that, just something simple. Right now, they're doing the Great Flower Hunt for kids and whoever. Where we're in spring, the flowers are coming out. There's tulips out. There's wisteria out. There's all kinds of color. So right now, people are going around taking pictures of redbud trees, counting flowers, noticing colors, and even learning the names of plants that they probably have never known. And then, on a really personal note, the people I hang out with and their friends are into trivia. So all the trivia contests have been shut down. There's a couple Rotary. There's a Rotary trivia here in Boonville that got canceled. The Elks Club in Columbia has one once a month on a Friday. That's all done and that's over with. So we once a week go on Zoom, and whoever wants to join us, we play Trivial Pursuit on Zoom because we like trivia. So that's just one way of staying engaged with your friends, right? So whatever floats your boat, reach out and do it. You can do it with Zoom. Everybody's using Zoom right now, except my brother-in-law says it's going to ruin my computer. So there's that. But anyway, that's what I wanted to talk to you about, was all the potential health-related problems that are coming up, especially in this sort of forced, not quarantine, but forced disconnection. So stay socially connected, just stay physically not around a whole bunch of people, at least for right now. Okay, good to see you all. Thanks for all joining in, and I will talk to you Monday at 10:30, and I'll try and figure out how not to goof this up by next week. Okay, talk to you later. See ya. Bye.